I'm going to tell you guys about the Hoover test. I actually had a hard time finding any videos that demonstrated it, and hopefully my words and these examples are going to make a little bit more sense. The Hoover test is meant to assess for malingering, which basically means faking it, like they aren't giving out full effort. And so if people have hip, lumbar problems, SI joint or pelvic problems, this is a great test to do for them to see if legit they're not able to do some of these tests like the straight leg test or any of the other tests that you ask them to do for motion, because one, they don't have enough strength, or two, because they're just faking. So what you would do is you would grab their feet, and they don't have to be high off the table, they're just really light. The point is you're just putting their heels in your hand, and what you would do is say, okay, I want you to pick up your right leg just a little bit in the air, and as they pick their leg up, you should feel a downward pressure, so a counter force coming in their opposite foot, and ask them to lower it down. And then you would say, okay, now I want you to pick up their left leg, and they would pick it up. And so this should have less load in it, and then this one should have more pushing down. And that's all exactly what should happen. If I tell her to pick up her right leg and she tries to pick it up but can't pick it up, so she contracts and I can see it but it's not going anywhere, this foot should still push down because again, there's a counterbalance. Now what makes this a positive test, if I say, okay, what I need you to do is I need you to pick this leg up, and I feel nothing happening in my heel, I don't see, or in my hand, like her heel's not trying to pick up at all, and I see no muscle contraction on this side. And then on top of that, there is no force going down, so she's not trying to counterbalance on this side pushing down. That is a positive test. So basically, I'm holding her legs, and I feel no changes in the forces either going up or pushing down on either one of my hands. And again, that is a positive Hoover's test. And if it's a positive test, you should very gently call them out because they aren't putting forth effort. Basically, they're just laying there, and this is like the liar, liar, pants on fire version of a clinical test.